We've been caring for this community for the past 40 years. We want to make sure we are well positioned to care for this community for the next 40 years.
This is a community hospital. Our focus and our primary mission is to care for our community.
In order to be successful, you have to grow. Expenses are going to go up by inflation, and our revenue is kind of set on a per discharge basis or a per visit or a per procedure basis. And our expectation over the next several years is that we're going to see declining reimbursement and increasing expenses. So our only way for there to be the financial support necessary for us to be able to achieve our goals is for us to grow. One of the ways that we've been able to achieve the growth here over the last few years is by focusing on various service lines. You know, our strategic plan calls for focus on outpatient imaging, orthopedics, bariatric surgery, and really the whole surgical services platform.
So when we think of value in healthcare, we're really talking about the highest quality at the lowest cost, and how we find that balance of being able to drive high quality, because that's most important to our patients. That's what our patients expect as baseline when they come into our hospital, is that we're going to provide safe, quality care for them.
We have wonderful tools and support to develop the right programs and projects to improve where we need to improve. But the key part is sustaining it. We have to continue to pursue these things relentlessly, even once we've improved. Care redesign is how we are going to go from the processes of the past to the processes of the future. We all know and recognize that standardizing care and ensuring that each patient gets the right treatment at the right time is a critical part of our success. It brings us the resources of understanding what we do and the tools to put new processes in place that will help us reach our goals. It allows us to share ideas across hospitals. What may be done really well here is something to share to benefit the other hospitals. We may learn something through care redesign from University Hospital or from Duke Raleigh that we then can bring home to improve ourselves here.
Diversity is so important to Duke Regional because it is who we are. Our community is diverse, and that means we have to be prepared to minister, to work, to develop, to grow alongside our diverse community. What I see for the future of Duke Regional is continued growth. We're going to continue to develop our staff to make sure that they are providing the best service possible. We're going to continue to recruit the best and the brightest who want to come in and be a part of our community to deliver that excellent care. Some of the things that will come out of the emphasis on people and environment, I expect that there will be more engagement among staff because their voices will be heard. There will be more opportunities for staff at all levels to be involved in decision making, and hopefully will also give us the opportunity to make continued improvements in our operations. And as a result of that, we should expect to see a greater awareness to the details of their job, which means our patients get excellent care.
One of the things that we have to really remember is that at its core, healthcare is about people helping people. That's why most of us went into this field.
I think we're very lucky to work here in the culture that we have.
We call it the spirit of Duke Regional, and the spirit of Duke Regional is really all about our people. It's all about the team that we have here, and it's a sense of community, it's a sense of family, and it's a sense of doing always the very best to care for our patients, their loved ones, and each other.